Hello, it's Dr. Rhonda Johnson. Today is Tuesday, October 25th, 2022. And today, folks, I'm talking about the polio situation in New York. Well, there's continued detection of poliovirus in wastewater. That's the same as sewage samples in and around New York City. And recently, polio's been detected in sewage samples from Brooklyn and Queens. So what does this mean? Well, folks, it means that the virus is continuing to be shed. That means that people are continuing to be infected with this virus because poliovirus only infects humans. Now, transmission is extremely contagious. It spreads through person-to-person contact. It lives in an infected person's throat and intestines. Normally, people get infected through the mouth, through contaminated food or water. Now, most people, if they're vaccinated, if they get infected with this virus through contaminated food or water, they don't get sick. And they don't even know they've been infected, especially if they've been vaccinated, fully vaccinated for polio. Now, the virus can be shed in the stool for weeks. So what's happening now? You know, the State Department, Health Department declared a public health emergency. And now the CDC is considering, they're in the very early phases, according to a spokesperson, using an oral polio vaccine, which is new, for the first time in more than 20 years to stop this outbreak in the greater New York City area. Now, this would be a novel form of the polio virus. It's different than the oral polio vaccine used in many parts of the world. It is more stable and less likely to mutate in the wild, according to the CDC. Now, in the meantime, folks, don't fool around with this if you live in the New York City area. If you or your children have not been vaccinated for polio, or you don't know if your vaccination series is complete, or you think your children may have missed a few doses in the pandemic, get caught up as soon as possible. Currently, we're using the inactivated polio vaccine that has been used here in the United States since 2000. It is a killed, chemically inactivated virus. It can't replicate. It can't cause disease. It's been used for years and has an extensive safety profile. You got to remember, folks, that there is no treatment for polio paralysis if this virus gets into your nervous system. You can be paralyzed, which is a rare complication, but it does happen in the short term, or you can suffer post-polio syndrome years later. Now, for those folks who travel to New York City frequently, or have extended stays, please talk to your healthcare provider to see if you should get a inactivated polio booster. That's my message today. As always, take care and be well.